Good afternoon. I'd like to welcome everyone to our monthly webinar, Catching Them Early. My name is Peter Cribb and I'm the National Director for the CATCH program with the Michael and Susan Dell Centre for Healthy Living at the University of Texas School of Public Health, the Austin Regional Campus. Before we get started, I would like to take care of a little housekeeping. First of all, our webinar today is being recorded and an archive will be made available on the CATCH USA website by the end of the week, along with the PDF and the presentation slides. During today's webinar, we encourage you to ask questions via the chat box, which you can access through the control panel at the top of your screen. You can type in your questions at any time, but to keep us on schedule, we'll try and hold off answering them until the Q&A portion at the end of the presentation. When typing your questions into the chat box, be sure to select the option to send your message to all attendees. I would like to begin by thanking the Michael and Susan Dell Foundation and the RGK Foundation for providing funding for this webinar series. Next, I'd like to let you know a little bit about the Michael and Susan Dell Centre for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families and communities. Our work fosters improved health behaviours among youth, influences policy and environmental change to support healthy living, and advances professional education and community service. Our vision is healthy children in a healthy world. You can find out more about the Centre and our work in school health on our website www.msdcentre.org. It is now my pleasure to introduce our special guest for today, Dr. Shrila Sharma. Dr. Sharma is an Assistant Professor of Epidemiology and a faculty member of the Michael and Susan Dell Centre for Healthy Living at the University of Texas School of Public Health. Dr. Sharma is a behavioural epidemiologist with specific interest in chronic disease epidemiology, primarily development, implementation and evaluation of nutrition and physical activity intervention studies to prevent or reduce obesity via preschool, school, family and community-based approaches in understanding children for their families. Dr. Sharma is a principal investigator of numerous studies, one being the Catch-Up study funded by the US Department of Health and Human Services for evaluating the CATCH Early Childhood program among low-income preschoolers enrolled in Head Start. She also serves as a co-investigator on several federally funded projects, including Lunch in the Bag, preschool nutrition education study funded by the National Institutes of Health, and the CDC-funded Childhood Obesity Research Demonstration in Texas, addressing system-wide obesity prevention among low-income children and adolescents. Welcome, Dr. Sharma.
Thank you, Peter. And I want to start by saying thank you to the Michael and Susan Dell Center for Healthy Living for giving me the opportunity to present this webinar on catching them early. So a little bit on what we are going to discuss today. I'm going to start out by presenting a little bit on the current status of obesity in the United States, specifically honing down on obesity in early childhood, especially with respect to socioeconomic status and disparities in obesity. And then looking at the risk factors to obesity from a behavioral standpoint, recommendations for nutrition education and physical activity in early childhood, and then finally going into the CATCH Early Childhood program that I've been involved in for a few years now, describing it, presenting some data that we are in the process of publishing, and also sharing some other strategies for obesity prevention in early childhood. So starting out on where we are right now as far as obesity in the United States is concerned, as you can see from this figure, it's upwards of 20% of the children are overweight, are obese, and 7 out of the 10 states with obese children are from the South. And these are 10 to 17-year-old children classified as obese. If you look at early childhood, this is data from PEDNIS, which looks at WIC participants. The prevalence of obesity among children from these low-income families increased from 12% in 1999 to 14% in 2011. But during 2008 to 2011, 18 states and U.S. Virgin Islands had a statistically significant decrease, and only 3 states increased during this time. So this is the more recent data, which shows actually that the rates of obesity, especially among preschoolers, might be stabilizing. If you look at obesity from a socioeconomic perspective, we do know that there is a disparity there. So if looking at this BRFSS data, 35% of adults with no high school diploma were obese as compared to 22% of adults with college education. If you compare this to low-income preschoolers, we see with the secular trends, there's an increase in obesity. This is data from Mike and colleagues. They published this paper in JAMA in 2006, which looked at adolescent overweight status by poverty status. So they looked at disparity in weight status by socioeconomic status for adolescents ages 12 to 17, and essentially found that the overweight prevalence in the poor children or families, children that came from poor families, was 1.5 times that of non-poor. And the disparity was higher among the older adolescents, so 15 to 17-year-old children as compared to the 12 to 14-year-olds. Looking at, from the same paper, they presented risk factors for adolescent overweight by age and poverty status. And if you look at these 3 figures, you have 3 different behaviors. So your physical inactivity in figure A, caloric intake in figure B, and proportion of sample that skipped breakfast in figure C. And this looked at NHANES data from 1999 through 2000, and I think it was 2004. And as you can see, that there was increased proportion of those who were in poverty that were also physically inactive, had greater caloric intake from sugar-sweetened beverages, and skipped breakfast, which essentially means that you have adolescents who are coming from a lower socioeconomic background that also have these risk factors, higher prevalence of risk factors to obesity. So what does this mean with respect to the bottom line for trends in obesity among U.S. children and adolescents? So here, looking at this figure, you can see in 2 to 5-year-olds, 6 to 7-year-olds, and 12 to 19-year-olds, it seems like the childhood obesity rates are stabilizing, but they're stabilizing at high levels, especially even if you look at just early childhood, you can certainly see that as well. More than 12 million children and adolescents who are obese, and there are more than 23 million who are either obese or overweight. So we have a very large burden of obesity, especially in children and adolescents, on our hands in the U.S. And what's even more disturbing in terms of obesity trends is that extreme obesity is still on the rise in adults as well as in children, especially among minority populations, and this continues to grow. Just to give an example of Texas, we have a high prevalence of obesity. I'm sorry, you need to go back. Okay. With 36% of 2 to 5-year-old WIC participants classified as overweight or obese, and this disparity is particularly more apparent in Hispanic early preschool age children, with 45% of them classified as overweight or obese. Now, taking a bird's eye view, I wanted to share this interesting figure which looked at, from a global perspective, where are the obesity trends going? And from the top, you have Africa, Asia, Latin America, developed countries, which includes the United States, developing countries, and globally, what's happening in children ages 0 to 5. And you see that across the board, in all countries and parts of the world, there's an increase in prevalence of obesity in preschool age children. So the burden of obesity is high here in the US, but it continues to be high across and seems to be on an upward trend globally as well. So moving into the causes of obesity, we know that obesity is a function of energy intake exceeding energy expenditure. I'm sorry, these slides are moving faster. Okay. Children are exposed to a toxic environment of obesity. There's a lot of literature out there that supports, portion sizes have increased, marketing to children has changed, where it's predominantly focused on marketing of foods that are linked to obesity. Fewer family meals, increased screen time such as TV use, computer use, video games, lack of neighborhood safety, so children are not playing outside as much as they used to, decreased physical education time in the schools, lack of recess time as the children are getting older in the schools as well. So the children are pretty much residing in a highly obesogenic environment in the US, and we're seeing similar trends globally as well. As far as consequences of obesity in childhood, there's a lot of data that shows children who are obese are 80% more likely to also be obese as adults. 70% of obese children have at least one of this cardiovascular disease risk factors, and 39% of obese children have 2 or more risk factors for CVD. And there's an increasing prevalence of type 2 diabetes among children who are overweight and obese. We also know that children are not tiny adults. Their metabolism is different than that of adults. There's an accelerated progression of insulin resistance to type 2 diabetes in children as compared to adults. Obese children also experience asthma, sleep apnea, and non-alcoholic hepatosteatitis, which is a fatty degeneration of the liver, and which in turn, as adults, increases their risk for other chronic diseases as well. Which pretty much means we know that we need to start earlier in life with respect to obesity prevention. Which is why we suggest targeting not only preschool age children, but perhaps earlier as well. So why target preschool age children? Adiposity, or body fatness, increases in the first year of life and then decreases, but a renewed rise is seen again at 5 to 6 years of age. And this is termed as adiposity rebound. But children who experience early adiposity rebound, that means they are obese earlier, between ages of 2, 3, 4, and 5, are at a higher risk for obesity later in life, which makes it particularly important and relevant to target preschool age children and even earlier on. So we do know from the data that we've seen thus far that the behavioral risk factors to obesity primarily include nutrition and physical activity. So how much, if you're trying to target nutrition education, how much nutrition education is enough? Especially if you're looking at school and preschool-based approaches. this figure, you can see what's recommended, what's necessary, and what is provided typically for nutrition education. And if you just look at what's necessary, it's about 41 or 42 minutes of nutrition education per week to see an effect on changing dietary behavior. And what's provided is about 7 minutes per week. So we are a little far away from our target as far as nutrition education is concerned. And we also know that we are a little bit away as far as reaching the targets for physical activity. These are the guidelines for physical activity in early childhood, which say that preschoolers should accumulate at least 60 minutes of structured physical activity a day, and at least 60 minutes of unstructured, up to several hours of unstructured physical activity a day, and should not be sedentary for more than 60 minutes at a time, unless they're sleeping. It also has several guidelines with respect to developing motor skills in preschoolers, access to both indoor and outdoor areas, and also with respect to caregivers and parents responsible for understanding and promoting these skills in early childhood. The IOM report identifies several action items or priority areas for early childhood. I apologize for the timer with the slides. Hopefully we won't have that problem as we continue. But this is just identifying some of the priority strategies based on the IOM report in early childhood, suggesting increasing physical activity, increasing fruits and vegetable consumption, reducing intake of energy-dense foods and sugar-sweetened beverage consumption, breastfeeding initiation and duration, and decreasing TV watching. Which leads us into the Catch Early Childhood program. So this program was developed specifically to target these behaviors related or for promoting healthy nutrition and increasing physical activity in early childhood for children ages 3 to 5. And it was developed based on the successful elements of Catch. So we have a lot of data over the last 20 years with respect to Catch, proving not only to increase or promote healthy nutrition and physical activity behaviors, but also in terms of reducing obesity in children that are at highest risk. So we used the same theoretical concept with respect to Catch and developed all the Catch Early Childhood program elements, which include physical activity and nutrition education for preschool-age children in daycare or school settings. So it's a preschool or daycare, childcare-based program. The goal is to be a center or a school where everyone is working together and speaking a common language that creates and maintains a healthy learning environment. So the idea is to enhance the opportunities that the children have for receiving nutrition education, as well as opportunities to be more physically active while they're at school. We have data to suggest that children in preschool are spending a majority of their time in sedentary behavior, and in fact only 3 to 5% of their time engaged in moderate to vigorous physical activity during their time at preschool. So we are trying to target some of those sedentary behaviors and make the environment more active, and also to enhance the learning environment for nutrition at the schools. It's composed primarily of 3 components. We have classroom lessons that are led by the classroom teacher, physical activities that can be done both indoor and outdoor, and parent tip sheets. And I'll go into each one of these in a little bit more detail. So the classroom curriculum, it's Fun to Be Healthy, and it consists of 9 nutrition and 10 gardening-based lesson plans. And the lessons are focused on healthy eating behaviors, primarily to encourage and increase preference, willingness, and intake of fresh fruits, vegetables, low-fat dairy, whole grain foods, and healthy drinks. We also have several hands-on and interactive activities to promote healthy snacking. And one of our catch mottos is, if it ain't fun, it don't get done. So we want to keep it fun, and so there's lots of songs and stories and games to make it fun for the kids and the teachers. There's extension activities and curriculum connectors at the end of every lesson that tie in the lesson with all the learning centers at the preschool. For example, the teacher can use pieces of the lesson to tie in to their math center, their science center, their vocabulary center, their art center. And also the activities can be sent home to tie in with what the communication and to encourage dialogue with the parents. And the 9 parent tip sheets which are bilingual in English and Spanish complement the lesson plans sent home to the parents. The physical activity box comes complete with over 500 structured physical activities. Sorry about that. And the overall goal is to increase moderate to vigorous physical activity, which is your MVPA. There's warm-up, there's classroom management activities that we encourage the teachers to start early on in the school year. There's go activities which are aimed at fitness, coordination, strength, flexibility, and cool down activities including fun things like yoga that the teacher can do with their children both indoors and outdoors and with or without equipment. The activities are also adapted for children with physical disabilities, so everybody gets to participate. The most recent resource we've added to the Catch Early Childhood cache is the Catch Early Childhood Coordination Toolkit. And this is the resource that will help you tie the Catch Early Childhood pieces throughout your entire preschool. The toolkit helps you coordinate the efforts across your center and reinforce the messages for Catch in every activity that the child is engaged in. So with the toolkit, there are 6 themes, and we suggest doing 1 theme every other month throughout the school year. And the themes include, there's a lot of fun activities like the Catch Kickoff Week, Healthy Holiday Celebrations, New Year or National Nutrition Month, Healthy Summer, Blast Off to Health. And each theme has key activities outlined so all the center faculty and staff are involved in a coordinated way. So for example, the activities for each theme would have a bulletin board that the teacher would do with their children, would have a craft activity in the classroom. They would teach a health lesson from the It's Fun to Be Healthy classroom curriculum. The physical activity that they would choose would tie in with the lesson that they're teaching, and then doing activities that also encourage the family and parents to be part of the learning environment. So one example, the first theme, which is the bulletin board, is the Catch, join the Catch MVP team. So this is to give y'all an example of what the bulletin board might look like, with the healthy lesson being the introductory lesson from the Catch It's Fun to Be Healthy curriculum. So teaching lesson 1, and these were some more recent pictures that we took, of another bulletin board. And this preschool actually took it one step further and made Catch t-shirts or Catch MVP t-shirts, which the parents came to school and helped the kids and the teachers make them. So it turned out that everybody was singing the same song, if you will, across the center in coordinating the Catch messages. Next, I wanted to share with everybody some data that we are in the process of publishing, where we worked with Harris County Department of Education Head Start centers in Houston. And this map gives an idea of where these Head Start centers are located. And Head Start demographic, as many might know, is predominantly low-income minority. And this table provides some results from the pilot test that we did in about 300 children in 6 Head Start centers in Houston. And we found significant increases in servings of fruits and vegetables consumed, which we measured during direct observation. And in addition to that, we found that there was an increase in the amount of time spent in vigorous activities, which went from 0.6%, so only 0.6%, so less than 1% of these children's time was spent in vigorous physical activity, that baseline, which went up to 9% post-intervention. And they implemented Catch Early Childhood throughout the school year. And the key to program success really was the completion of all program components, or the implementation of all program components. So these teachers were able to integrate the lessons into their existing lesson plans, integrate the physical activity. So the teachers were doing both. They were doing physical activity as well. There were no separate PE teachers, so they were doing both. And they were able to integrate into their existing lesson. So it was not over and above what they needed to do. And they found it to be a very valuable resource. It tied in very well with the other objectives that they were supposed to meet. So making it easy for the teachers to implement really informed program success in this case. So where all is Catch Early Childhood? We're also implementing Catch Early Childhood in a large CDC demonstration project called Texas CORD. CORD stands for Childhood Obesity Research Demonstration. And it's being implemented in Houston and Austin, Head Start centers and pre-Ks. And it's also being implemented in several other variety of preschool sites across 6 states in the U.S. So what else can we do? Just to sort of tie up, it's not, like I said, Catch Early Childhood is a resource. In addition to that, we need to have an environment that fosters healthy nutrition and physical activity, and we can do that by several strategies, including increasing accountability with respect to promoting healthy eating and physical activity in preschools, training and providing training opportunities for preschool staff in how do you actually do this, and how do you integrate this and institutionalize this, modeling of healthy eating and physical activity by both teachers and family, and increasing opportunities for parents to get some of the skills with respect to nutrition and physical activity, perhaps through these their child schools and preschools. Some other opportunities might be expanding, having gardening or expansion of farm to school or preschool programs, farmers markets, and incorporating policies related to no food rewards or not using food or junk food for fundraising at the schools and preschools. And finally, monitoring preschooler BMI, nutrition, and physical activity trends. So these are some of the other ideas that could be implemented to promote healthy habits in the preschool environment. So I thank you all for listening to me. And at this time, Peter, do we take
Yes,
questions?
please, if you have a question, please feel free to write that into the chat box. I've got a couple for you, Shrila, if that's okay, if we've got a moment. I often think about the little ones as I'm watching them sort of bounce around and thinking about how do you measure? I mean, what sort of tools did you use to measure them? You mentioned they were observational and so on.
Right. We've used accelerometers in children to measure their physical activity levels, and we've also done direct observation. So, which essentially is, we've modified a tool called the SOFIT, which has been used in older children and for the preschool age, and we've used that to also do direct observation of physical activity while they're at the school. So as far as nutrition goes, we've measured those as well using direct observation and parent surveys as well of what they're eating while they're at home. So while they're at school, looking, because they cannot tell you, at least not not in any reliable perhaps sort of a way, but at least you can, by directly observing at school and combining that with information at home, you can measure those things as well. So the other question I see here is, do you measure motor skill development as well? We haven't yet done that, but I think that is a very important, we have that metric as part of the SOFIT. When we adapted the SOFIT to the preschool age group, we have some of those metrics in there with respect to gross motor skills, but we need to do a better job of that.
Here's another question here, Shrila. How do I find out more information being submitted in regards to measuring behavioural change?
With respect to how we measured a behavior change, well, we will be publishing one of our papers which will give more information. It's in press, so that'll give more information on how we exactly went about doing this. But I also welcome any inquiries through email. I'm happy to share our protocols that we used to actually measure this.
I've got another question here too, Shrila. How do we get our school districts to do away with the unhealthy snack machines their students frequent after school? Are you aware of any state mandates that may be coming down in the future?
I'm not aware of any state mandate. That certainly unhealthy snacking is probably one of the behaviors that is linked not just. It's linked to sedentary behavior because children, while they're watching TV, they're snacking. So unhealthy snacking is a considerable problem, especially in the younger age group, because they do a lot of snacking rather than just eating meals. So it is something that from a preschool perspective, that the individual preschools can work in developing those policies, and the parent association. So some of the preschools I know in Houston, the parent groups have been very active in, and even in school, the parent groups have been active in trying to promote unhealthy or remove unhealthy snacking from their preschools.
That would have been a question to ask too. How have the parents responded? You mentioned some have PTAs and so on.
Yeah, it is so our biggest challenge is to engage the parents, because the kids and the teachers have the buy-in. The kids find it fun, the teachers have had it, they don't find it difficult to implement, but the parent engagement is always what's been challenging. But working with the teachers and having that coordination toolkit to lay out the themes from a monthly basis and pull in, it gives you ideas on how do you actually pull in. So we've had parents at the table as we're planning and rolling out the implementation. So the parents can guide us because parents talk to other parents. So they can guide us in how do you work with parents in getting them engaged and keeping them informed and having them be part of the decision-making process with respect to rolling this out into their child's preschool. So parents really need to be at the table from the beginning when doing this. So that's where we found the biggest success, is when parents are at the table.
Okay. What about the teachers? I mean, not everyone likes change, and we're coming in there, we're perhaps asking them to do some things differently than they may have done before. How have they responded?
So we worked primarily with Head Start system in Houston, and they have sort of a 3-level system. So there's the Head Start organization administration level, and then there is the individual center level management, and then you have the teachers. So there's a 3-level, and usually the directive comes from the overall administration that, okay, we are adopting this program for implementation into our centers. And the center manager then takes on that responsibility of working with their teachers and how this might look. Because it might vary. You know, it's the same program. What we say about Catch is it's a resource, right, for all the teachers and to use to enhance the environment at their schools and preschools. But working with, so where we've found the biggest bang for our buck is working both from the top level down, but also from the bottom up, where we have the administration, working with the administration on how to roll this out, but at the same time keeping the conversation going with the teachers on how will they integrate this? How will this look in their lesson plan? Is this feasible for them? And if it's not feasible, then why not? And we found the biggest success is once the teachers, so getting them before they integrate, so during the summer training period when they're formulating their year and developing their lesson plans, working with them at that time to roll this out. So it's in their lesson as they're starting their school year. That's where we've, so all our trainings we've done are in the summer before the school year starts. So it's in their lesson plan and it's part of their fabric.
Great. And I would imagine there too, because we've seen this in the after school a little bit too, is that the confident level of the instructors and the teachers may not be that great around nutrition concepts.
Right, right. Yes, so I think, so one thing that we've learned is we cannot just train and leave and never see. So having that ongoing touch point with the teachers and providing them with the resources to enhance their level of nutrition education, physical activity recommendations that are out there, because teachers, you know, they have their plate full and they're doing the best they can, and I think it's our job to provide them and empower them with the resources so they can do their job better and integrate these into their existing requirements. So it cannot, I think, just train and leave. That scenario just does not work. You have to, and there's teacher turnover, you know, that's another challenge. So consistently working with these pre-Ks and with the organization as a whole helps in having them not just adopt it, but having them be part of the conversation on improving their children's health and having them sort of elevate their environment at each of their centers.
And hopefully taking those messages home with themselves.
That's right. That always helps, yes.
Dr. Sharma, thanks so much for being with us here today.
Well, thank
you. Really appreciate it and sharing what you're learning in the field.
Yes.
And if you don't mind, I'll probably ask you back again in the not too distant future to bring us up to date.
I'm happy to be there.
Thank you.